Good afternoon. I'm starting this, although we're going to give it just a few more minutes because we have quite a large group of people that registered for this event. So I just want to make sure we give a little bit of time for everyone to get in. This is being recorded. Thank you for joining, and we will start here in just a few. So you do have a few minutes to go grab a water or go do a bio break really quickly. And also just as a ahead of time, please make sure your phones are muted. I do have a colleague on. Thank you, Liz, for joining me to make sure she's monitoring chat for me because I'm flying solo today. And also it's really hard when there's background noise to ensure that everyone can hear what's going on. This is day one of Supportive Housing Fidelity Reviewer training. So if that's what you registered for, you're in the right place. So, also, we cannot use AI in these meetings. So if you have an AI program set to record your teams or it automatically does, please know that you need to delete that or take it off. I will do my best to monitor that as well. It's an HCA policy that we cannot have AI on our webinars. I apologize, as I know many of you use those to record meetings for note taking, but we are unable to have that on our webinars here at the state. Liz, we're at 1:05 and I want to make sure we have all the time we can. So if you don't mind kind of monitoring the chat and also letting people in, that would be so wonderful of you.
Yeah, I've got you.
Thank you. All right, we're going to go ahead and get started. We do have a much larger group registered, but that doesn't always mean that everyone can attend. Things come up all the time. So we'll probably continue to let people in, but I want to go ahead and get started so we can be mindful of time. We have 2 hours today and there's 2 hours tomorrow. In order for you to be a fidelity reviewer on a review team with myself or anyone from my team, you do have to complete the entire reviewer training. I'm going to stop and ask questions throughout this. If you have questions in the chat, I have Liz kind of monitoring those for me. And we will hopefully have a little bit of time to talk before we close out today. And then we do have the 2 hours tomorrow. Okay, if you're from HARPS, can you email me on the side, just an FYI? I have to do something additional to make sure that your program manager knows that you are HARPS and came to both days. So I just saw a note in the chat, Kevin, if you could, and Megan, if you guys could just email me on the side, just to remind me that you are a HARPS team member so that I can make sure Wanda gets what she needs to show your contract deliverable. Thank you. Well, hello and good afternoon on a Monday afternoon. Appreciate you all being here. If your phone is not on mute, please mute it. The background noise can be very distracting. And we want to make sure we have all the time we can to talk through this. Fidelity reviewer training does tend to be a lot of information. So please, if you want to do what you can. And of course, if you have additional questions beyond today and tomorrow, I'm always happy to spend individual time with you. My name is Kimberly Castle. I am the Foundational Community Supportive Housing Program Manager with the Healthcare Authority. I've been with the Healthcare Authority just a few weeks short of 8 years. I've been with the FCS team the entire time since its implementation here at the state, and provided supportive housing and homeless outreach out in the communities prior to me being here. I was part of the original Porch Project, which is our first pilot project to do supportive housing in Washington State. And that's where we actually started working on utilizing these evidence-based practices to show better outcomes. I've been able to do this for quite a long time and get the honor of going out and doing fidelity reviews for the FCS programs across our state, and have seen some really great work happening, and I've been able to really have some great conversations. But today we're going to talk about all things fidelity. We're going to talk about kind of the whole process and what it looks like to do a fidelity review. We're going to go over the principles again. So if you're really well versed in supportive housing principles, this will be a good refresher for you. This is also a great opportunity for you to ask questions and listen in on other folks' questions. And you all being here. We're going to go ahead. I'm trying to make sure I don't miss anything. Okay. All right, so let's go ahead and get started. So today, well, this is for the 2 days because I don't know how far we'll get today, and then we just kind of finish up tomorrow, depending on what we get through today. We're going to go over introductions. I'm going to have you guys pop in the chat who you are, where you're from. That helps us kind of better understand who's attending these, how long, maybe even how long you've been providing supportive housing, and in particular FCS supportive housing for the state. Why we use evidence-based practice in the first place. I'm going to give an overview of permanent supportive housing, mostly around the principles, and hopefully this is an overview or a review for you. But if not, this reviewer training isn't necessarily designed to be like a basic 101. It is really designed for folks who have already had kind of an overview of supportive housing with me. If you haven't, that's okay, stay, but some of the fidelity measures and things might be newer to you if you haven't even experienced some of the information around the principles of supportive housing. So, and then we're going to talk about, what does a review look like? What does that entail? So, excuse me. Also, what do we how do we score those things in the review? What is consensus scoring? How do we write the report? All those things. And so we'll cover all of that in the next 2 days. And then, of course, I want to make sure I'm answering any questions you have. We're already doing lots of fidelity reviews. We have this entirety of the program except for the first year we implemented. And it is something that we expect FCS providers to participate in and engage in. And so this is really a great learning tool. We take people out on fidelity reviews with us. So after this, if you're interested in being on a fidelity review with me, this is something you can do once you've completed this training. And so it's a great way to really embed the fidelity measures into your program, as well as understand what other programs are doing when you go out and review with me. All right, so you're already doing this, introductions, add your name, role, maybe how comfortable you are with PSH as an evidence-based practice. If you're not familiar with the PSH, SAMHSA's PSH fidelity evidence-based practice, then that's really what we follow. If you're a HARPS, person and you're doing HARPS out in Washington State with Wanda Johns, they also follow the PSH from SAMHSA. And so what we do in a fidelity review is very similar, or almost identical, actually, because we are following this evidence-based practice. And so although HARPS is not exactly the same as FCS, we're both providing supportive housing. And so these principles are key, no matter whether you're doing FCS, HARPS, or any other type of supportive housing services. This is the best practice for how we serve folks to make sure we're getting quality services across the state, as well as making sure that we're getting the outcomes that we desire for the folks that we are serving. All right, what is an evidence-based practice, right? These practices come from rigorous research. So there's folks out there doing this research, taking data, compiling it, showing the differences between before a program and after a program to show outcomes. And this is really key in deciding whether we wanted to follow evidence-based practice. And actually, Washington State has been kind of dabbling in evidence-based practices in some of our programs since very way back. 2011 is when the first supportive housing program was implemented here in Washington State, called Porch. And that's when we started learning some of these dimensions and how to utilize them to ensure better outcomes. But really, it's a lot of research. It's a lot of us, a lot of folks doing the work to show that these practices work. a lot of data to back that up, and eventually they can become part of an evidence-based practice inventory or best practices inventory. Washington State was actually legislatively mandated in 2013 to provide or to utilize evidence-based practice, promising practices, or best practices in the programs that we serve from the state level. And so the majority of the programs that you may navigate that come from state are typically following some sort of best practices to ensure we're getting the outcomes that we hope for folks. And really, we'll talk more about this, but it really comes down to it almost being a recipe for you to follow, almost some guardrails for you to look at to say, hey, I'm following this recipe. One of the things you'll hear us refer to around a Fidelity is that award-winning chocolate cake recipe, the one that you are dying to be able to duplicate, right? And so if you're following all of our 7 principles of supportive housing to that recipe and doing what it asks, you're going to get the best outcomes. You're going to get that award-winning chocolate cake. But if you start changing ingredients, start changing the cook times or the heat and all of those things, things definitely hinder or develop different outcomes from that award-winning cake, right? So think of this as your recipe for the best outcomes you can get for individuals. Not everything is cookie cutter. It does take some interpretation when you're not necessarily a behavioral health organization. These were definitely designed back when mostly behavioral health was providing these types of services. And now we have a lot of other types of agencies, a very diverse provider network providing supportive housing. And so we want to make sure that even though it's not cookie cutter and you can't just stick it in the program and call it good, that there are ways to get to that fidelity. And this is a great way for you to learn how by navigating through what a review would be in an agency and helping figure out what those recommendations would be for individuals receiving support or for the programs providing supportive housing services for those folks receiving supportive housing. Has guidelines describing critical components. It's going to tell you, like, we have 7 principles. We follow 7 principles. Those principles each have different parts of the dimension, talking about how we address those or what we're looking for. And so knowing those are really important to be able to build your program around those components and thinking about fidelity through implementation all the way through serving folks. And sometimes we don't know about this until we've already implemented our program. So then it might take some time to go back and look at how we can ensure the 7 principles of supportive housing are embedded in the program that we're working within. There's always a guide, right? We have the toolkit, the PSH toolkit that you'll get the link for at the very end of this training. If you want to go to the SAMHSA website, most of the toolkit is still on the SAMHSA website. If you can't find all the dimensions, I think there's a couple that might be not on there. I have all of them. So if you ever want the entirety of the toolkit, you can come to me, or you can go to our Pathways to Housing website and it's on there as well. I made sure that when SAMHSA was doing some changes that I grabbed all of those things and made sure we had them for you all to be able to access. If I could get a raise of hands just really quick, how many of you are, for sure you're already implementing evidence-based practice into your supportive housing program? I'm just curious. Okay, see some hands. Great. Awesome. I love it. It's getting busy out there. I'm seeing at least 12 people. Wonderful. So that's great news. That we already have lots of programs out there doing this. We actually have quite a few supportive housing programs in FCS that have done multiple fidelity reviews over the years. All the way back to like 2019, I think, is when we started actually doing fidelity on a larger scale. And so there's some folks that have been using this around their program from the very beginning, and there's others that have realized that this is something that needs to happen and are now working to implement this into a program that they had already kind of developed, which is a little bit more of a challenge, but definitely doable. And so part of what we want to make sure here is that that you have myself and other folks on my team that can help you navigate through how to do this. And then my job really as a trainer is to solely support you in providing training and technical assistance around these principles and the evidence-based practice as a whole. So thank you for sharing who's all already working on this. And you might have some great insight for others that are more new to this work.
Kimberly, there's a question, if you can drop that link in the chat, or did you say that you're going to be sharing that after the fact?
It'll be probably tomorrow. Let me see if I can grab it really quick. It's not always easy to copy from this. I'm hoping it's not showing up. Okay. So actually, and I will share, the other thing is there is a whole inventory of promising practices and evidence-based practices. And this evidence-based practice is part of the inventory, we call it WISPA inventory, about evidence-based practices and promising practices. And there's not a ton of them, but SAMHSA is one that is considered truly an evidence-based practice. There's a lot of other folks out there that have dimensions and principles around supportive housing, but they haven't been researched. They haven't been deemed evidence-based yet. So they might need some more time or more thorough research before they would be part of an inventory like the WISPA inventory. But this is, I just dropped a link in the chat for the kit, the toolkit. And I, of course, like I said, I have all the things around the toolkit and then some if you're interested in learning more. So why do we assess fidelity? We want to make sure that we're really thinking about how we provide choice to participants. And also, I'm just going to ask, if you're not wanting to ask a question, go ahead and put your hand back down. Thank you. I'm sorry. It gets to be like, should I ask? Is there more questions? So thank you. I appreciate the engagement. So we want to make sure that we're really maximizing the idea behind choice, as we know, and I'll talk a lot about choice here in a little bit, but as we know, the systems typically take choice away from folks. And so part of what we want to make sure we're doing is empowering individuals to make choices for their own lives. And our jobs as supportive housing specialists or supported employment specialists is to really think about how we can empower folks in order to do that by giving them informed choice or helping them understand what those choices look like, not minimizing the choice or telling them what you think is best for them, but allowing them to determine that from the full choice that's out there. And so we'll talk a little bit more about that later. This is part of your daily practice. If you really think about evidence, and I wish I had some of my providers here that have been doing it a really long time and believe that it's the reason why they're successful, and we do have those, is it's really part of what you do every single day. These are things that we implement into how we serve people every single day. So although this is going to look really structured, if you think about it, are you asking people what they want? Are you having conversations about how things are happening, what they would desire? It's not about just what they need, but also what they want and where they live and who they live with and what services they receive. And so we're really want you to think about these dimensions as part of the everyday thing that we do with folks as we're serving them in our programs. This can also be part of supervision. This is a great way to talk about how you're providing services, what the outcomes are for people, what you're struggling with, how you're having a hard time maybe understanding one, or how you know how to navigate one. Choice is a hard one in the housing market right now, because I always get told, Kimberly, how can we provide choice when there's no choices out there? So there is times when we have to like really go into supervision, asking how we navigate some of the challenges around being able to provide services to the best practice. Not entirely, but there's elements that might be a challenge. Maybe it's the community you work in, maybe it's just the market, maybe it's the participant you're working with, right? There's all different factors in how we serve folks and what happens there. Excuse me. And so thinking about how you can go into supervision, or if you're a leader, how you can use fidelity measures to talk about supervision for folks. There's more and more that shows PSH is effective and is continuing to grow. We know that you hear housing first all day long, and also we're being told that housing first is not going to be something we maybe can say all the time. But as you know, the idea is that we believe that someone goes into housing when they desire it, and we can teach them the life skills along the way. And so we're seeing more and more proof that that truly exists. And these measures really matter. Long-term outcomes, like I said, this is really about those outcomes that we desire for folks and that folks desire for themselves. And so the more we can get closer to being able to do it a way that tells us, we know we already have research behind it that shows that if you follow this, you're going to get better outcomes with folks. Of course, we're doing this also to show quality assurance. It's a great quality assurance measure, not only for the FCS program as a whole, but for you as a provider. If you're reaching good fidelity, it's a great way to measure or to leverage new funding, opportunity for your agency to say, hey, we have had reviews, we keep meeting fidelity, sometimes exceeding fidelity. This is, proves that we are following evidence-based practices, and that we are getting the outcomes that we desire for folks. And so this is another way for you to get opportunity for your agency, and all the while ensuring your folks are being taken care of. And then, of course, I don't know about you, but when someone gives me a guide to tell me how to do the work the best, I love it, because then I'm not floundering trying to figure it out on my own. So it does increase job satisfaction, lower risk of burnout because you have boundaries, and we'll talk more about where that exists in this. And then, of course, we know that if we're providing good quality services, then we're doing what's right for the participant in the way that we're helping them determine how they want the next steps of their life to go to move into self-sufficiency. And it improves the other life domains like, feeling well, doing well, interacting with their community, engaging with services as they need, and all of the things that come with those health-related social needs that we address all the time in this program. I'm still seeing hands up, so I just want to make sure, Michelle, Garrett, or Katie, do any of you actually have questions, or did you still have your hand up from the last question? And there might be more Katie Johnson or Garrett's and Michelle's. I'm not sure. I just want to make sure. It's fine. Don't feel bad. I just don't want to feel like I'm ignoring you if you do have a question. So this graphic you'll see a lot if you're working. Don't feel like you have to apologize. It's all good. This graphic you'll see a lot in PSH. We've been using it since day one of supportive housing, or for FCS, and it's been used. I believe this might have even been a CSH graphic that we borrowed. But this is the 7 principles of supportive housing. We're going to go through each one individually. But I would say this is a great tool just to have this up even, and just remind yourself when you're out serving folks, these are the elements that we need to be thinking about when we're serving folks. And this isn't just about the direct face-to-face services. We're also talking about documentation. We're talking about keeping files. We're talking about disclosure. We're talking about all sorts of pieces to how we serve folks. And so this isn't just about the face-to-face interactions we have, but how we overall serve somebody to make sure that they're being taken care of, that their choices are being honored. There is the link again, just in case. You guys will get this PowerPoint when we're done after tomorrow, and there is some active links in it. So if you didn't get it from this chat, you will have that in this later. So I'm curious, let's go back here really quick. I'm curious if someone's willing to come off cam or come off mute. You don't have to come off camera, although I do love seeing faces. I'm not going to lie. I do like engaging eye to eye, even if it's through camera. Maybe somebody pick a dimension out of these 7, which is choice, separation of housing and services, decent, safe, and affordable, integration, rights of tenancy, access to housing, and flexible voluntary services. So the idea is if someone would be willing to come off a mute and tell me what dimension would you choose? Pick a dimension, and why is this dimension important? Let's start there. Is there anyone that's willing to start the conversation?
I will.
Okay.
So mine is choice, because you want the peer to be able to choose where they want to live. You just don't want to sit them in some place they don't want to live, because they're not going to want to maintain their housing there if they don't want to live there.
Absolutely, Kevin. So what we know from this and doing this is that when someone is engaged and invested in where they get to live and they get to choose that, they're more likely to not only be more successful in that housing, but stay longer in that housing. Because now, and we'll go to another principle, now they feel more integrated in their community and feel part of their community, right? So from my historical doing direct service, we used to have to ask this GIPRA question. Do you feel like you belong in your community? And I would say 99% of the time, and we'd ask this every 3 months, I'd still get no matter how long you were doing stuff, right? So that learned to teach us how to integrate people to become part of their community, to build those natural supports, to find education or job or groups or things that will help them really build that sense of community, right? And so that's where that choice comes in. How do you think we measure choice? What do you think? I mean, obviously we're going to learn about this, but I'm just curious. Does anyone know how we would look? Go ahead, Virgil.
I would think it would be by their understanding of the choices they have.
Yep. And if we don't, what? It isn't done.
We make sure that they understand.
And we document it, right?
Yes.
So
Yes.
that whole golden thread, if it wasn't documented, it wasn't done. So in order to show that you're providing choice, there's ways to do that. And we'll talk about that in a little bit. So part of how we can measure it is seen not only by documentation, but by having conversations with the participant and some of those other things that we can see choice is being provided. They're doing the steps to make sure someone has that choice. They know what they get to look at, what they, and we're not here to minimize that or only give them like restricted choice. That can be a real problem because sometimes people need to see what they can't have to realize what makes the most sense for them, and not can't have, but maybe it's a long-term goal. I guess I should reword that. It's about showing them what maybe won't be feasible right in this moment, but it could be something we work towards together. And so the idea behind maybe showing that 2-bedroom washer and dryer in the unit with a pool kind of thing that people sometimes desire versus what they might be able to go into today, but it doesn't mean we're not going to show them that. It doesn't mean we're not going to talk about it. We're not going to ask them how they would sustain something like that. It means we're going to have that conversation to make sure they feel fully informed before they make decisions for moving forward, because we want to make sure that they understand the choice that they're making and not have any bias in that. That's really up to them, and it's our job to help them get there or support them in figuring out how we can get them there. How would you know if you're providing choice? Is there any kind of key thing that would say we're making
Hi,
it happen?
Sarah.
Oh.
Sorry. It's Sarah.
Hi.
I was just thinking too, I don't know if everyone uses these tools, but the, desired housing forms and things like that really help outline and keep both the participant and the provider kind of accountable or aware of what those choices are, what those desires are. And then I think, from there, like you said, using other tools like housing searches or job searches, and really sitting down with them, and both people are looking at what's out there, what's available, what wages are available, what rent costs are. But yeah, I think keeping tight track of all of those forms and completion of them or updates of them in each chart is also really important.
No, great. Thank you for bringing that up. I was going to wait till choice to talk about those, but since, yeah, I mean, there are assessments out there. What are we using to show that we're asking the right questions, right? So Sarah comes from an agency that uses those assessment tools. Some of those go as far back as Porch. Those assessment tools that say, hey, what kind of house do you want? Do you need a place for a dog? Do you need to smoke? Do you want to live with somebody? Do you want an upstairs, downstairs? Do you want to be in a rural community? All of those things. It's okay for someone to have wants and needs, even though we're going to be like, of course, they just want to be housed. Well, not everyone is going to be housed in just whatever, because they want a specific thing and that's what's going to feel like home to them. And so we are here to help them figure that out. So those assessment tools ask not only what do you want, need in housing, but what kind of supports once you get into housing would you need? Are you somebody that just needs support getting into a house and you feel really independent and have done this before? Are you somebody that's going to need someone to navigate systems with you, help you get connected to resources that you haven't been connected to before? These are all really important pieces to that choice element. And so there's lots of tools to use that show, if I were to come in and do a fidelity review, you're asking about choice, right? It's not just that well point assessment when you get them into, but are we really having the conversation? And like someone said, I think it was Erica, just ask, and then document. And then are there multiple choices you can show them before they pick one, right? And so really making sure that you're using the tools that exist to allow you to open up the conversation, ask some questions. Maybe they don't know until they know, right? So you're there to help them kind of navigate. Well, I don't even know what recovery residence is, Kimberly. Well, let me talk to you about that, right? And that allows them to really think through what makes sense for them, as opposed to having somebody say, this is where you're going to live. So choice is key. And I'm not just talking about housing. I think it's really the core element of how we provide good services to somebody is that we allow them to have power in what we're doing with them and how that looks. And so that might even be how often we see them, where we see them, how long we see them for, those kinds of things. All right. What do you think? And obviously, I think we can all say, well, the obvious one, but what do you think is the biggest challenge of providing choice in this current moment? Because I can tell you it was very different 10 years ago. What is the challenge with providing choice right now when you're working with somebody? Vacancy. Yep. There's just a lack of affordable housing. There's just a lack all across the board. Whether there's availability of housing, most of the time it's not in the reach of most of the folks we serve, right? They're on limited incomes. Some have no income. Some folks can't access the same type of housing as others because of backgrounds. There's all sorts of barriers to all of the things that make it choice possible. So we have to be really creative when we're thinking about choice. And it's not a take it or leave it. I get that all the time where, well, they get a choice, they either can take it or not. That's not exactly giving someone choice, right? So yes, pros and cons. We should be talking about pros and cons, sustainability. Can we integrate people? I have a great story about integration we'll talk about later. Price is a big one. Most of our communities are being priced right out of their housing, and which is why we have a bigger and bigger unhoused population than we used to. We're just getting priced out. And so we have lots of things to do on the other side of housing, which is the capital and affordability and all of those things that we still have to address as well. But part of what we do as supportive housing specialists is hopefully navigate them through the system without too much pain and help them understand the system, help them understand why we're making choices with them to do these things, why it's important to maybe think about going through systems. We have a lot of folks that don't even want to go into a system, put their name in a coordinated entry, all those things, right? So it's part of our job to just have those conversations. And if they really don't want to, we have to honor their choices. Lots of less subsidized. There's rural communities that have zero PSH or subsidized housing. When I was working in PSH, we didn't have any subsidized, or when I was working in supportive housing, we didn't have any PSH in our community. And I think there might have been maybe 1 or 2 HUD subsidized housing options, and they were always full, right? All right, thanks for engaging. I appreciate that. Okay, so the premise is, like we just talked about this a little bit, we should be asking preferences. I can talk, I'm sorry. We want to follow their direction. They get to choose and they get to tell us where they want to go. We're never the ones to tell them, this is what I think we should do next, unless they say, I'm not sure what the next steps are. Okay. Well, of course, we're there to help navigate them. One of my coworkers always says we're like their GPS or their co-pilot, right? We're going to help them navigate there, but we're not going to tell them. We're going to help them get there. We're going to be their co-pilot in this, and we can help give them the steps to get there. But it's really their choice how they decide to move forward in whatever they're doing. So really working to be side by side. We should be partners. You know, if you're working as a peer, you know that we walk alongside folks. And the idea is that we allow them to really navigate what we're doing with them, and we just do what we can to support them. And also that, like I said, like we have to be honest, we have to give them the pros and cons. It's part of our job to give them that informed choice, which means sometimes we have to have the conversation like,
Hey.
Yeah.
So it doesn't look good for this property.
Oh, I think someone's on.
Unfortunately, the way that it's all calculated, and then with rent calculations too, they.
Okay, sorry about that. I don't usually like to have to meet people, but so the idea is that we're really walking along by somebody doing unbiased work with them. Obviously, if you're a peer, you're sharing your story when relevant or when appropriate, but really helping them kind of navigate their own individual needs. What do they need? Not everyone's the same. It's not cookie cutter. It's not going to be, this is the same for everybody. I should never go into a fidelity review and see copy paste kind of treatment planning or documentation notes. It really should be very individualized because every person's different and might need different needs. And never telling somebody again, and I'm going to say this probably 100 times, and you all know this, but we don't want to tell people what's best for them, right? We want to make sure that the end goal is really permanent supportive housing. That's really the whole point behind this, is that we are moving people into independent living, where they can have a lease in their name, that it's not time limited. Now, of course, if somebody is at the very beginning of their housing journey and they need transitional before they move in because that's what they want to do, we are going to help them get there. If they want recovery residence, we're going to help them move into recovery residence. The idea is that we're really helping them move into that end goal of independent living, where they can really feel like they have their own home, right? Even if they're renting, that's fine. We just want them to have as much full rights as possible. And we'll talk about that in a little bit. All right. These are in a nutshell. I say that because you can't fit everything sometimes in a slide, but these are our 7 principles. And this is kind of like we're measuring. So for choice, we're measuring the degree of choice offered to a tenant or to a participant. So did we see that they looked at multiple places or asked about multiple places? Did the case manager do that with them? Were there assessments? That's an easy way to show me you're asking about what they want and need, right? If I see an assessment in a file, I'm like, oh, they're asking some questions. They're having that conversation. Did the participants say, I want the first thing that comes along? And that's what you did. That's, you're giving them the choice to say, I want the first thing. Okay. So choice in the type of housing, meaning give them the full menu of options. Then they can, and more, I'm going to go into more detail. I don't want to go too much on this slide because we have actual slides for this. So separation of housing and services, we're measuring the extent to which functional separation exists between you as a service provider, a support housing specialist, and the housing manager or the landlord. There should be clear separation between those duties. And we'll talk more in a few minutes about that. Decent, safe, affordable, we're measuring the affordability, the amount of money someone's paying towards their rent from their income. Are they living in a place that would or could pass HQS or HHS inspections? Are we doing those with participants? Even though it's not official for a voucher, are we still having that conversation? Integration is really the extent to which individuals' housing is not in set aside. So I'll give an example later, but sometimes we have so many people living in set aside, they're all the same population. Everyone's had to be homeless. Everyone has to have a mental health diagnosis. Everyone might be even getting the same services in the similar places, right? That's non-integrated, meaning they're not getting any access to things that happen outside of that kind of population. So we want to help folks integrate into their community. And what does that look like? Rights of tenancy, we really want people to have as full rights of tenancy as possible, meaning they're signing a lease just like any one of us would be able to do without a bunch of additional rules or exceptions. Okay, so we'll talk more in that space. Access, this is one of my favorites outside of choice. This is housing first. This is, do you believe someone has to prove readiness before they get housing? Absolutely not. When is the best time to help someone start find housing? Speak up. I know you know this. When they ask. One of my favorite responses to asking somebody, how do you know when someone's ready to be housed? And someone told me, we're all born ready to be housed. It's just a matter of us saying when we're ready, right? We're all born ready. So if a participant says I'm ready, and they're actively engaging in active use or whatever the case may be, that doesn't mean that they're not ready to find housing. It's our job to work alongside them to build the skill sets and help them get there. And it's housing first all the way, even if we're not going to call it housing first down the road. I love seeing faces because I can read you kind of read like you're nodding with me here. The last one is flexible and voluntary services. This is the biggest dimension of all of them. This goes down to choice of services, participant voice, flexibility, caseload sizes, and we'll go into all of that in a hot minute. If not today, tomorrow. Yes, it's a basic human right. Thank you, Virgil. Absolutely. When they say they're ready, absolutely. Yesterday, thanks, Kevin. Yes, whenever they are ready for housing. And sometimes we have discussion a lot because I used to do outreach, and I would have folks that didn't want housing until they had employment. And a lot of times the assumption is, well, if they're homeless, they want housing. But that's not always the case. Sometimes they're not ready to commit. Sometimes they're not ready to do that thing yet. Some people want employment first, or some people just aren't ready to go in to housing the way that they feel like they could do it. And so our job is to help them, walk alongside them, see what skills they want or whatever they need to do to get to a point where maybe they do want to start seeking out housing. And that's why we have outreach. That's why we have folks going out there and serving people while they are in that maybe sometimes pre-contemplation or contemplation stage. I actually really love this slide and I might use it more often. It's something I ran across that I made a long time ago and forgot about it. So that's how long I've been doing training. All right, choice of housing. So I love this slide because do you either get Dr. Pepper or Diet Coke, or do you get the whole aisle that you get to choose from? So are you really offering someone the full menu of what's available in your community? Maybe it's not in their price range. Maybe they're not even eligible. We don't know yet. We're giving them all the types of housing that exist in their community. Then we talk about it. Tiny homes, permanent supportive housing, sober living, Oxford, which is very specific, right? Because it's sober living, but there's much more structure to it. Do you want to own a home eventually? Apartment. I want a 2-bedroom house, Kimberly, with a yard because I have dogs and kids. And that's what I need, right? So asking like the whole menu, what's available in your community? Make a list. Do we have tiny homes? Do we have transitional housing? All of the things. We need to make sure we're offering the whole menu. And then we start helping them think about what each of those would mean for them or how that would be something that maybe they are into, or maybe they will totally veto it, right? Nope, recovery residence is completely not my jam. It's not what I need. Cool, we'll mark it off the list. Let's move on to other things. Are we showing them multiple units? Now, in fidelity reviews, a lot of times I have to be like, well, this is kind of hypothetical in this housing market, because how often do you go to an apartment complex and they have multiple units available? Usually it's one, right? And if you can find one. And so, but the idea is, if they were given an opportunity to view 2 apartments in a building, would we ensure we advocated to show them both? Maybe they want that upstairs unit. Maybe they can't do upstairs. They need that corner bottom unit. Maybe they don't want to be in between folks because of whatever is happening with them. Maybe they have some internal stimuli, things like that. And so having additional noise around both sides can cause issues for them, right? So having those conversations, because there might be something that makes the most sense for them. And that I can't do stairs, Kimberly. I can't see myself going up and down, having to go to the laundry room downstairs, all the things, or whatever the case may be. We want to honor that and listen to that. That's really important. So we need to be sure that we're offering them all the ways that they can see units to make that decision. And back when I was doing housing, and I sound like, oh, way back in the day. It feels like that now after this many years. But back in the day, my kids would say back in the olden days, when I would do housing, it was possible to show them at least 3 units before they made a choice. Right? I could say that. Let's try to look at least 3 before you make that decision. This day and age, if you don't jump on something fast, sometimes we lose it, right? So having the idea of like thinking about how are we navigating kind of some of that things to be able to show them different places, because maybe they see one and they think I'll take the first thing because I'm living in a tent right now, or I'm living in a, on the side of the road, or whatever the case may be, right? But we want to make sure folks do get to choose a little bit from those things. We don't want them to have to determine it right in that moment because that's the only thing offered to them, and that they do get to have some time to contemplate whether that's going to be really work for them. I've housed folks in places they were sure was going to be the most amazing thing in the world, and 2 weeks in, a month in, sometimes even longer, it isn't what they thought it was going to be. The community is different. The feeling of it's different. A weekend night is different than a day in the middle of the week feels different, right? So we need to have those conversations. We also want to make sure folks aren't losing their place in line. So I always ask people in Fidelity, if you showed someone 5 units and they still didn't find something they liked, how would you proceed? Would you be like, apparently they don't want housing that bad. Guess I'll put them on the back of the line and start serving someone that really wants housing? Would we be like, I guess, they can't make up their mind and I have somebody that's sure? You keep looking. Thank you, Heather. You keep looking. You keep serving them just like you always would. There should never be a time, for one, I hope we don't have a bunch of wait lists in FCS, but there should never be a time when someone's getting priority over another because they can't find what they're hoping they need to have, right? We would never want to force someone into a unit. That's where that informed choice comes again. You just keep working with them. I almost feel like some of you have been in some of my trainings before. Choice of living arrangements. Again, we want to make sure people also have choice of the composition of their household. And so although there may be programs that limit that, we need to have those conversations with them. I used to work in a program where we had some TBRA vouchers, but the TBRA program would not let you do roommating. And that was because we learned some hard lessons and they decided they weren't going to allow that, right? 2 people on a lease with one only owning the voucher was a little bit of a problem when things didn't go well. So do we have to have the conversation? You either choose to live by yourself or find a way to pay your own rent, right? Those are conversations that actually exist in our housing system, unfortunately. So do they get to choose who they live with and what that looks like? We hope that that is the choice, or the options that they get given is that they're getting to choose who they live with and what that looks like. There are exceptions. Recovery residents kind of sits in the middle where some recovery residents allows you to choose maybe the room you live in, maybe who you live with, but you don't get full choice. Oxford, you get zero choice. You could be living on the couch. You could get voted off the island tomorrow. You get zero choice. So there's differences there. We need to make sure that that's clear to the participant. And yes, they get to choose whether they go into those spaces, but that still doesn't mean they get to choose their composition. Okay. Never, yes. Just stay working with them. Just keep it up. Just keep doing it. They will find something. And I have all sorts, if you guys want to hear some good stories about housing someone over and over again, I have got some good ones for you. I don't know if we'll have time for it in this one, but you can always reach out. So we talked about informed choice. I'm just going to go over this quickly. You know, obviously we want to support someone's decisions based on the information we can give them, to give them information that actually is relevant to their situation too, right? We don't want to give them a bunch of random information. They're like, okay, well, I'm still not sure how to make this decision because that has nothing to do with me or whatever. Make sure you're really thinking about how it connects to what they're doing or what they're going through. Make sure you know the facts before you give someone information about housing. I'm sure all of you have had somebody that thought when they got into supportive housing, that just meant you had housing for them. So be careful of your language. Think about how you're informing them. They might hear something and be like, oh, and it's not actually, they're not actually, it wasn't being interpreted appropriately, or maybe they just misunderstood, but we want to make sure we're really clear about those things. Options, and think about the risk. Like I say, it's never bad to be real with your participant. In fact, they'll respect you more if you're not sugarcoating things and BSing them. I'll just be honest. If you can be like, listen, this could be the problem with this situation, this could be the risk, right? If you want to go into this housing, you have this many months of rent assistance, and then what does that look like? Or you want to go into this housing, but right now it does not pass a HQS and you have your name on the HUD list. What if you got chosen 3 months from now? Then you'd have to make the decision whether you want your voucher or relocate, which means then you're breaking a lease, right? There's different pieces to the choices we make. And so we have to be real. And then you want to make sure you document that conversation. Obviously, I'm going to talk a lot about documentation is really key here, but those are things we want to do when we're talking about informed choice. And then just thinking about the, person-centered approach conversation, make sure it's circular, make sure they get to engage in that conversation and it's not just you talking at them. Really want to have that space where they feel like they can talk through some of the things that they're worried about. And then of course we don't want to say, it'll be fine, we'll figure it out when we cross that bridge. One of the things I learned in supportive housing is that bridge comes way faster than anyone expects. So you get someone into a 2-year voucher and 3 months from the end, they're suddenly like, what am I going to do? Right? We need to be thinking about the big picture from the beginning, right? What's the next thing that's going to happen for them once we get them there? If we have the short-term voucher, what are we going to do to get them connected to long-term? How are they going to sustain rent if they choose to go into something that's a little bit pricier than they were originally thinking? Are we going to bring up employment? And I'll talk about that when we talk about affordability. Trying to think of what time we started. I want to make sure I give you guys breaks. So I'm going to go over this next slide. Oops, I might have skipped something. Nope, I didn't. We're going to go over separation of housing and services, and then we'll break so you guys can take a quick break to get water or whatever.
Wonderful.
Yes, Heather, consistently reassessing goals. Absolutely.
Wonderful.
Change. Our participants change their mind
so
often.
much.
And sometimes when someone doesn't choose the first 5 houses you're showing them, maybe we stop and have a conversation and say, hey, let's talk, because I'm noticing that from what what you said you wanted, we've been looking at some units and you just haven't found what you're looking for. Did you change your mind after seeing some things? Did I miss something? Or sometimes you'll find our participants, the closer they get to that commitment piece, that signing a lease, they start stepping away. It causes a level of fear. They've never done this. All of a sudden they're like, oh my gosh, can I do this? Right. So they start thinking, oh my, disengaging a little bit. And so those are conversations to really have with someone if you're noticing they just can't seem to commit to a place. And it's okay that they don't find what they want, but are they not finding what they want? Did they change their mind and you need to reassess what they need or what their goals are? Or maybe it's a talk about, I know this is scary because this is something very new. And, you're feeling like this is a commitment you haven't had to make before. And so if you notice that someone's struggling, this is a great place to stop and say, let's just reevaluate. Let's see where we're at. Doesn't mean we're going to stop serving you. Obviously, we're going to keep serving them, but let's reevaluate what you might need or what you're hoping for. Okay, separation of housing services. As I mentioned, our housing managers have a role. Our landlords have a role. Their role is to enforce lease, provide notices, give evictions, maintain the property. That's housing management, right? And then you as a service provider are really there to support and advocate, help that participant figure out how to navigate things when it doesn't work out or when they've lost resources or need resources, right? So the idea is the housing provider also trying to be the social service provider, which I'm sure some of you have navigated landlords that have tried to get in too much business, right? Where they're trying to support the person on both sides, and that can get really messy. And ooh, it's a hard conversation to have with landlord. Like, you need to let me do my job, right? And stay in your lane. Do you, as a service provider who's there to support your participant, out collecting rents, providing notices, giving evictions? Never. You shouldn't even be holding a key for somebody. Okay. You as a specialist should never have keys to someone's unit, all of those things, right? Now, if you work in PSH, the lines get a little blurry sometimes because PSH is 24/7. They have staff doing all sorts of different roles. And sometimes it can be very confusing to a participant that lives in a single site building to know who to go to. They go downstairs and they just find a human. And sometimes that's where lines get blurred, right? So in PSH, we talk a lot about the fact that if you're in a project-based type housing, as a service provider, you should never be doing any of that housing management. We should have boundaries that they know this is who you go to for this. And if you need maintenance, you go over here and this is who you go to for this, right? And that we should never cross those lines, because then it's harder for us to show that we don't hold housing over our participants' head. They should feel safe telling us, I relapsed last night and I spent my rent money. I need help, right? And we should be able to do that without having housing over their head. Hey, I don't know who's got their phone off mute, but can you please mute your phones so that we don't have any background noise? Thank you. So the line really should be drawn. So when I'm doing a fidelity review, sometimes I'll look at job descriptions, things like that, to see if there's any kind of weirdness there, that there's like a line that could be drawn or things that we can recommend to make sure we strengthen those barriers between. It doesn't mean you're not going to work with the landlord. Of course, that's part of your job, but you shouldn't be doing any of their duties and they shouldn't be doing any of yours, right? You work together to support that participant. All right. We're at 1:56. I want to go ahead and stop and give you guys a quick 10-minute break. So we'll come back at, oh, my sound just went weird, sorry. We'll come back at 2:16. You guys, let me know if you need anything. And I'm going to be here. I'm not getting up or anything. So if you have questions in the interim, you can definitely ask. But let's just try to all be back by between 2:10 and 2:15, and we'll get started again. Have a good break.
Kimberly, I don't know if you're able to give me extra permissions, but I can help with muting folks.
I don't know, Liz. That's a great question. I think, yeah, I think I can. I just have to go into Teams.
Okay, I was curious if it's just too after the fact, but I realized that I can't see if people are trying to join or if
Oh,
I
I
need
didn't
to
even,
mute folks. I didn't even think about that.
either did I. I think I can add you to, I think I can manage my meeting and add you. Let me look.
Okay, sweet.
These are still things we're trying to navigate.
I know I like this new webinar mode, but I just didn't even think of that before I hopped in.
Let me see. Manage event. Can I add Elizabeth? Let's see. I can't. I think you tell me. I don't know if I need to make you an organizer or a
Maybe make me a co-organizer and see.
Yeah. Organizer. And I'm also going to add you to presenters just in case
Okay.
it has some weird presenter mode stuff. Which again, we're still learning. So we'll have to,
Yeah, right.
or maybe. Okay. Let me know.
Yeah,
Okay. Does that make a
I
difference?
can, yep, I can mute all. I can end the event if I want to.
Maybe don't do that, but
I'll use my powers for good, I promise.
power now, all the power. Fine.
Sweet. Thanks.
Yeah, of course. Okay, I had all these people go to the link, and I'm like, oh, I don't know. Oh, sorry, Anessa, I didn't get you access either. I guess I didn't share it out. Thanks, Liz.
Talking off on mute. I said, yep.
Yep. I'm using a new PowerPoint this time, so I'm trying to navigate like time a little bit. Oh, didn't mean to do that.
Hey Kimberly, I just had a quick question.
Yeah.
I have to hop off around 2:15. I wanted to know if I could still come on the reviewer tomorrow.
Yes, and then anything you missed, we can touch base on and make sure you get the information you need.
Okay, thank you so much. I appreciate it.
And it's being recorded, so you'll eventually get the
Okay,
recording.
I just didn't know if like it was a compliance thing where I needed to be there the whole entire time.
Are you Harps?
No, I'm just
Okay.
FCS.
You're good.
Okay,
got
thank you so much. I appreciate it.
For our friend that just joined, we're on a break right now. Kimberly, you said we'll be back what time?
2:15 at the latest. I'm going to see how many people join at 2:10. Then we'll.
Okay,
Wanna-
perfect.
Yeah.
So feel free to grab a glass of water, take a bio break, and then we'll hop back in then.
Well, I just got bombarded by our harps people over here. Like, I'm harps. I got y'all. You're on here. Oh, apologize for any cat tail you see. Kevin, I'll get you that later. Probably after tomorrow, just to show that you were at both for Wanda. And I actually think Wanda joined us today. Thought I saw her. Maybe not. Oh, I see her on.
I'm here.
Nice to see you, Wanda.
Good to see you, Kimberly
Like I've
and
seen you
Kevin.
a couple of weeks than I have in a while.
Yeah. A lot of overlap.
A lot.
Hey, Kevin.
On my screen again. All your peeps are on here.
Yeah, I've been beating him over the head with the invitation and date and time. You got to get this done and just all the things.
We always make it work. We always make it work. It's weird. I looked at the registration. I had like 138 people register for this for today.
Oh, wow.
So about half made it. My mouth's a little off, but you know how I
And you're
feel.
going to be sending out the slides afterwards?
Yep, I'll send out the slides after tomorrow. Make sure people have the toolkit, the slides, and probably the the lead Fidelity cadre manual that we created for the lead cadre. I used
Cool.
to just for the leads, but now I'm giving it to everybody because it's a great tool to just have at your desk. So I'll make sure
Cool.
that.
You guys have been busy.
Yeah, we're getting ready to train our I think fourth cadre of lead reviewers in June. HP is going to come out, so I'll be sending out that application in the next month or so.
Cool.
I don't want to commit too early.
Right. Hey, Erica. Hey, Amanda. I'm glad you guys were able to make it. Erica and I just did a Fidelity review last week, Tuesday through Thursday, and we were reviewing Catholic Charities in Wenatchee,
Oh,
your old
cool.
stomping grounds. Yeah.
My old stomping grounds. That's right. That's what I loved was Sarah came on earlier and was like, "Hey, you need to use these assessments."
Was actually just gonna say that. Oh my goodness, she is amazing.
Sarah and I go way back. Way back, way back. 2 agencies ago, actually.
Hey, Garrett. haven't talked to you in a long time.
Hey, Wanda.
Oh, Garrett. I was like, that name seems really familiar. Hey, it's been a hot minute since I've seen you, for sure.
Yeah, I think the last time was at the Catholic Charities training in
Okay. Yeah,
Spokane. Yeah.
yeah,
But I mean, other than that, other trainings like this. So,
yeah. Well, nice to see you.
yep.
Not a lot of, I mean, there are a few folks from Harps that have been around. Mom, do you have like pretty good retention in Harps? Let's say.
Most agencies do, yeah.
Good. Let's say.
Spokane is one of those. Garrett's been with us since the beginning,
I was gonna say
I
since I can
believe.
remember. Yeah.
Hey, John.
Wanda's got a fan
So,
club over here. I like it.
sorry, we're taking over the chat.
No, it's great. I love it. We'll give it a couple more minutes and then we'll go ahead and get started again. Like I said, I wanna be mindful of time. But want to give people some chance to just take a minute from hearing me talk at them.
Hey, Sarah. Hey, Shay. Hey, Crystal.
There's
Boy, there's a lot of them on here.
a lot of Harps peeps on here.
There
I like
is.
it. So I apologize, Harps, if I talk too much about FCS. I not that we're hugely different in a lot of ways, but not in the services we provide anyway.
Right.
And a lot of you have FCS too on top of Harps. So tell Stacy I said hi, Michelle. Just saw her like what was that last week before last? I got to spend some time with her. We are moving and shaking in Fidelity reviews. We're willing to take more. So Sarah, or where are my other? I can just say, hey, Fidelity. In fact, Sarah, we've never done a Fidelity review of Catholic Charities.
They just had one last week.
Well, for Harps, yeah,
Yeah, for the Harps team.
very well versed in Fidelity in general. Hi, Gunner. I see you on here. I don't know if you're back yet, but hi.
Hey, Gunner.
I'm coming off mic for that one. I wanted to say hi to both of you. What up? I was gonna put in chat, what up, but
hey. Thanks for being here.
of course, yeah.
Not your first rodeo. All right. Give it just 2 more minutes and then we'll get back to it. So you've got a quick minute to just go grab a quick snack or something if you need it.
Hi, Heather.
Wanda, would it help to have just the roster or would it help to have certificates for your folks?
Just the roster would be fine, but if you want to do certificates, that'd be cool too.
Okay.
But not necessary, but
Hey, let
it'd
me
be
get back
cool.
to you. The first 2 days of the week are pretty chill for me, but the next 2 are not. So let me
Okay.
follow up with you and see. I'm probably can do it since it's pretty quick, but we stopped doing it in general for our trainings because there's just not enough bandwidth.
Yeah. It does take some time.
I know I used to do it for every training for every person, and I'm like, there's no way I could do that anymore. That was
Gotta
back.
manage that workload.
That was back when we were a lot smaller than we are now.
Yep. I can't believe it's been almost 8 years.
I know. We're like, what, 2 weeks out? I can't even believe it. It's just, and then I was telling Amanda that it's weird because our Catholic charity start date was like 10 days after, like 10 days, like it was March 20 something, and for HCA it was like March 16th, and I thought it was so weird how it was that close together that we started there and worked 7 years and then have been here longer than there now, but we started right around the same time. So weird.
Yeah, that's awesome.
Oh yeah, time flies. I know. It doesn't feel like I've been gone that long, does it? Some days I'm like, oh my God, that was a lifetime ago, Sarah. And other times I'm like, oh, how did that happen? How did we already go in almost a decade from being in direct service? You guys have to keep me grounded and relevant, see?
No, I remember like yesterday, you and Amanda out in the parking lot. I don't know, just coming and going and doing outreach.
Yeah,
Weird.
it is weird. All right, 216. We're going to go ahead and get started again. I hope everyone's with me. If you're not, we were just reminiscing and talking to HARPS people. We've got a good mix of HARPS and FCS here today, and maybe even some folks that aren't related to either, and that's okay too. So just a reminder, we do have this again tomorrow. It is the same time. And if you want to be considered that you attended the entire event, but have to step away for part of it, just let me know so that we can make sure you get information you need, because we really need you to be in the entirety of the training to ensure you get all the information before you go out on a review. But as a lot of you know, I love talking about Fidelity. So if you have to grab me on the side and spend a little time with me, I'm more than happy to talk about Fidelity because it's one of my favorite things. All right, we're going to go ahead and jump into finishing off the principles. So we're going to talk about decent, safe, and affordable. One of the things we talked about already was the HQS or HHS inspections. Now, this is not something that you as an FCS provider or HARP provider are required to be certified in. What we want to see is that you're taking one of those inspections out and walking through a potential place for somebody and having the conversation, would this pass? If not, use it as a tool to get to advocate for repair so that they can pass an inspection. A lot of our folks are using vouchers that require that, right? So we want to make sure that we're not putting them in a situation where they would have to break a lease in order to move when they did get their voucher, because a lot of our folks are on wait lists for that. The other piece of this is the conversation, would you even want to live somewhere that didn't pass? We do have folks that opt into living somewhere that does not pass inspection, and for their own good reason. Maybe it's in the neighborhood where all their support systems are. Maybe it's closer to their services. Maybe the only thing that doesn't pass is something simple that they feel like they can repair themselves and they don't care, right? It's like an outlet cover or something very simple. And they're like, I don't need that. So there are reasons why people choose to opt out. And if you were to, we always ask in FCS that you keep files or copies of the HQS in their file. So if you have an inspection that you've done, put it in the file. If they got their inspection through HUD or another voucher program because they had to, ask for a copy of that. I promise you, you'll be allowed to get a copy of it. If they opt out of doing an inspection for whatever reason, I would just put declined inspection on the inspection form and still stick it in the file. So there's documentation showing that you tried and that you tried to have that conversation with them. And even document you had the conversation. Well, this is why we do inspections, or this is why this is important. There's a lot of reasons we can use those as tools, and it helps us understand how many people are going into places that would not pass an inspection. And also that tool to advocate to the landlord is really important. And so even though we're not formally certified to do inspections, we've all done many inspections with folks over the years or gone through one with other entities that are doing them and have enough knowledge, hopefully. And if not, I definitely urge you to learn more about what makes an inspection pass. What are the simple things that we're looking for to make sure that somebody's moving into somewhere that's quality? So affordability is really about thinking about how much someone there is paying towards their rent from their income. So are they paying 30% or less, which is the sweet spot? That's where we want all of our folks to be at. Or do we have the majority of our folks paying 50% or more? And part of the way we track that is for FCS and historically for HARPS, and I think they've changed this now, we use the housing log to track those things. When somebody would move in, we track how much income they bring in, how much their rent is, and that calculates the percentage that they're paying towards their rent. It also can say, hey, someone's on a voucher. This is the kind of voucher. This is what they pay. It allows us to really decide when we're in a fidelity review. We have to do some math. Really, the only time I try to do math is in fidelity. My team knows this very well. But really, the truth is we need to figure out how many people are paying 30 or less, 31 to 40, 41 to 50, and then 50 and above. Now, part of this is like, if we see the majority of our folks paying more than 50%, I would say, why are we not connecting them to rental assistance? Is there something we can do to get them better connected to some way to get subsidized housing or rental assistance or things that can help them support that? One of the other conversations is, are we bringing up supported employment? And when I was a housing specialist and we didn't have an employment program back in the day, we had to talk about employment, but I was always scared because the minute you said employment to someone who's trying to get Social Security, they like shut you down, right? I can't work. I'm going on Social Security, whatever the case may be. And that's okay. We just need to plant the seed, and you might have to plant that seed 3 years in a row before they want to talk about it. Maybe it's just twice. Maybe you have someone that's really all about employment. And I've seen some people really change their lives around supported employment when the first year they told me they weren't going to do it. And the second year they're like, okay, let's talk about it. And then suddenly they're on their way to self-sufficiency, buying a home maybe. I've had somebody buy houses in my supportive employment program, and that was before supported housing program, sorry. And that was prior to me even owning a home. So it's really cool when you can see somebody go from absolutely not to, oh, my life has changed because I did this thing. And I have great stories around that. If you ever want to hear a couple cool success stories around someone deciding to think about employment. But that's one way to actually really sustain housing, right? Because vouchers aren't forever. If you get that golden ticket to Section 8 and you get that housing choice voucher, that's great. Stuff happens sometimes. Things get in, life happens, and sometimes we don't always have that golden ticket forever. And so how are we going to maintain housing and help people maintain housing without some, plan B, plan C sometimes? And employment's a great way to start having that conversation. Like in the long run, our main goal is really to get people independent, self-sufficient, and working us out of a job, hopefully. And then just really thinking about, like, are they safe where they live? Do they feel safe? Not whether we think it's safe, because my safety is going to feel different than your safety. I would hang in some places in my old neighborhood that most people wouldn't chill at night at or walk even sometimes during the day. So what I feel is safe may not be the same as others. So we want to make sure people aren't feeling like they are being pushed into looking at housing in maybe a neighborhood that doesn't feel good. Maybe it's a place that they used to use and they're trying to stay in their recovery. Maybe trauma happened in an area and they don't really want to go back in that space, right? So we need to make sure we're having the conversation of what feels safe. And as I mentioned earlier, a lot of times we'll go look at units during the day on a Tuesday. And of course, that apartment building looks calm and beautiful and whatever. But have you looked at it on a Friday or Saturday night? And of course, we're not probably going to go take our participants on a Saturday night to go look at apartments, but it could look very different. So asking some questions, maybe having them, like, if you could get a chance, maybe just swing by here and see what it feels like, on the weekend when it's very different. Everyone's home, whatever that may be. So thinking about the safety aspect too. It's not something that we have a document to show, but it's a conversation we should be having with everybody. So we talked slightly about integration earlier, and so I'm going to go into a little bit more detail. So we have what we call set aside housing and then integrated housing. Set aside is for all of those types of housing, like project-based, transitional, recovery residence, or sober living in general. Sometimes it's behavioral health housing. So those spaces that require you to have some sort of element that makes you eligible. Have been chronically homeless. So this is all people that have been chronically homeless. You're living with everyone that has had an SUD. You're living only with people that have had a behavioral health diagnosis. This is very common for these types of spaces, right? And so that would be non-integrated housing. And there isn't necessarily, we want to honor people's choices, and there's reasons why people choose to live there. But there's also a space where we want to bring people out into the community and help them integrate into their community, whether that's getting connected to a youth, or getting connected to a book club, or maybe it's a faith-based thing, or maybe it's a job, or whatever. I had a participant that really wanted to be in the art community, and so we started getting her engaged in the Friday art walk that they did, whatever the case may be, so that they can start building natural support systems that helps them get out of their housing and not isolate. It allows them to start meeting people that maybe they wouldn't have had met otherwise. And the reason I say that is I come from housing in a rural community, and we had 2 behavioral health organizations that served the Medicaid population. And we had very limited housing with 0 permanent supportive housing, no project-based, 1 subsidized building at the time. And so we had to work really closely with mom and pop landlords, private landlords, the folks that didn't do a lot of background checks, folks that, maybe had more opportunity to call us and want to be on, have us come and be part of a partner with them. So when they had an open unit, they would call upon us and we could fill that unit for them. We served a lot of folks at the organization I worked at, and we also had a lot of classes there. I think they probably still do. And my colleague and I used to run the recovery arts class weekly, and we had a lot of folks that were our participants that also joined the art class because it was just fun and something to do and engage. So we also had this landlord who had this great little, I think it was a 12-plex in a great location right by the courthouse, cute little apartments. And he liked working with us. That landlord would actually be one of those that would call us and say, hey, I've got a unit open. And so all of a sudden we found that we had, a good maybe 7 or 8 of those units filled with our participants. But we also found is that those participants were all getting served at the same behavioral health organization. A lot of them were attending the same classes. Then we had 2 that decided that they would brawl in the parking lot after art class. And they also were neighbors now. Whoopsie. So because of that, we were putting strain on them, their housing, and the landlord, right? That can really start creating some landlord issues when you have 2 people that know each other too well, sometimes don't get along, and now are, not getting along a lot. And so now they're neighbors and they're living next to each other. And we didn't see that at first, right? And so we had all these people that were getting services from the same organization, spending a lot of the same time together, and now they're neighbors. So they're not really getting integrated in the way that they're meeting new people. They're getting new opportunities. They're becoming part of their community in a way that doesn't make them feel like they're just being with the same people they see day in and day out. And this is, of course, a rural community, so it might be different in the urban settings, and it is a lot of times, but just an example of how we had to start being mindful of how many people we house in one complex, one area, right? To give them opportunity to have more integration in their community. And those ones that chose to live in sober living or more of a non-integrated setting, that was great, but we had to be creative in the way that we did get them out in the community, thinking of new ways to integrate them so they can meet people and get them opportunities to maybe become more a part of their community and feel like they belong a little bit more and not feel like they're in these set aside settings, or sometimes some of these settings can feel really institutionalized. So those are things that we want to really think about when we're integrating someone into their community. So thinking about all the scattered site options, those are the mom and pop, the private landlords, somewhere out in the community that anyone could live in. The subsidized housing, sometimes that's a little bit mixed, because you have a mix, like 25% has to be homeless and the other 75 just have to be low income. That allows you to be a little bit more integrated in those ways, but really thinking about how we're housing folks depending on where you live, because rural communities have less options than some of the urban. It seems like, of course, urban communities are dealing with higher prices and housing and things like that as well. But what can we do to be creative, engaging people in their community? So rights of tenancy, is there a lease in their name? So we have lots of housing types where they wouldn't get a lease. Transitional doesn't have leases. Sober living doesn't get leases. There's certain other types of housing that's not exactly a full right of tenancy lease. We have lots of housing that has legal leases, but they also have 2 or 3 additional addendums with house rules. Rules around guests, rules around parking, rules around all sorts of things, right? And the more addendums you start having somebody sign, the less legal right they have to their unit. And we want to honor their choice. So I don't want you to think that we aren't going to house someone that doesn't have a full right of tenancy lease. We absolutely are going to house them wherever we can get them where they want to be. So if they want to go into sober living, they might only have a house agreement. Would you get a copy of that house agreement? That should be in the file. If you're moving into transitional where it's a little bit different, it's sort of a lease, but has some pretty strict rules around maybe drug testing or curfews and things like that. We would definitely help someone go into that type of setting, but we'd also want a copy of whatever agreement they signed. All of these agreements, whether it's a legal lease or house rules, it tells the participant what their responsibility is and what the landlord's responsibility is. And that helps us advocate when issues come up. Whether it's a legal lease or not, we can still use that as a tool to say, hey, I know they're talking about maybe voting you off the island because you're doing this or you're not staying sober. What did you agree to? Or a lot of times it's like, oh, you said you weren't going to smoke in your unit and now you're mad because you have a 10-day. What did you agree to? Well, you signed something saying you wouldn't smoke in your unit, right? So let's see how we can fix this. Let's see how we can find you a place to smoke outside your unit so you don't get in trouble. So having those leases helps us advocate on behalf of that individual. If they decline, we can't make them give us a copy of their lease, but a lot of our folks aren't hanging on to it or putting it somewhere where they can reference it, and they're going to look to us to help them navigate when something comes up with their landlord. So we really want to think about how many rules are they signing? If they are signing additional addendums, are you talking to them about what that means for their housing? That you don't have full rights. This isn't exactly, you can't necessarily come and go or have whoever you want here whenever you want, those kinds of things. And so making sure that we can help them understand, which is why I always say, if you can go with someone and they allow you to sign their lease, it's a great way to be able to help them not only understand what they're signing, because a lot of our folks have been homeless so long that they're not really reading a lot of the stuff. They're just like, I want to get into housing. So it helps them slow down, navigate through the lease, help them. Maybe someone didn't tell you that they're not good at reading or writing, and maybe they don't want to admit that. So you being there can help them navigate that lease when they're not sure. Maybe there's something in that lease you're going to catch that you do not want a participant signing. And I have lots of examples of weird stuff that's happened. But by me being there, sometimes it's helped mediate that issue. So having someone present to help kind of navigate that with somebody is great, but there are going to be participants that want to do it on their own. And then can we just get a copy of the lease you signed? Or can I get a copy ahead of time so I can make sure there's nothing there that we should talk about? So those are all good best practices around making sure folks are signing leases in the way that they understand them, but also the end goal or the main goal here is to really have folks living in as full rights of tenancy as possible, so they feel like they have ownership to their home in some ways. All right, we already talked about this a little bit because folks talked about choice and things, but is there readiness criteria, even unintentionally? So the reason I say that is in a review, we would review policy and procedure. And sometimes, even when we call ourselves a Housing First program, one sentence in a policy can change whether you're truly housing first or not, whether you're not requiring readiness. One of the things I find, and I'm going to just talk, and yes, Kevin, landlords are sneaky. I've seen some really shady things in leases over the years. So just always be aware that not everyone doesn't try to pull something. Okay. So there are lots of times when I go into a fidelity review, and part of that you're going to learn is that we interview case managers. And as someone who managed a program before, you think about those things where maybe down the road, someone was really struggling to try to house someone that didn't have income. So they decided, I'm not going to house anybody till they have income. Like, I won't be really serious about housing them till we get them income. That's not what the participant asked for, but that's the case manager deciding it's just too hard to house someone without income. And this is my least favorite statement, but I don't want to set them up to fail. Okay. And so what happens is that case manager has now put some bias into how they serve somebody. And then maybe they're a great case manager and leadership thinks they're housing first up here. And then they put that case manager in charge of training the next new case manager. And that new case manager now has a bias about affordability too, or having income before they house. And then suddenly you're no longer really a housing first program. And sometimes leadership doesn't realize that's even going on because it's not in policy. It's not something that's like obvious, but that's just how they've started to manage serving folks. And so we see this pretty commonly, that sometimes it's just bias that happens unintentionally. And then suddenly it becomes kind of the rule, without even realizing that that's somehow become how it's happening on the ground. So we need to be really intentional about making sure that we have strong policy around no readiness requirements, that we are housing first, and that we are making sure folks are trained to know that there shouldn't be bias in any of those things. And sometimes it happens unintentionally, but we can fix that and correct it and make sure that the program is still running and being trained consistently around housing readiness, and that there shouldn't be any. Do we prioritize folks with barriers to housing? In our program in FCS, it already kind of organically happens through eligibility criteria, whether you are already having barriers to housing. But are you just doing first come, first serve, or are you going out and bringing people into your program are you going out and doing outreach and bringing people to the program? Are you thinking about how you're are you going out to an agency or a shelter or somewhere where you're sitting there for a couple hours, just bringing people in, talking about your program, screening people through? What does that look like? Do you have prioritization? Some agencies actually say we serve the folks that are chronically homeless first, and then someone that's at risk would get served after that. So there are prioritizations that exist in different programming. And so one of the questions we would ask is, if it's first come, first serve, it's not bad. It's just you're not necessarily prioritizing the folks in the same way. So those are questions we ask. Obviously, we talked about access to entry. You should never have entry into a unit unless someone's inviting you in, even if it's been agreed upon otherwise. Unless you have fear that somebody is harm themselves, you would still follow the landlord-tenant laws and get the police involved, the landlord. You would never still just enter a unit, and make sure, we shouldn't be holding keys. If an agency is keeping copies of keys for whatever reason, that should be someone in leadership that has it locked behind locked doors so that anyone can get access to those keys. This is really for making sure that our participants are safe and that you are all safe, because I have actually witnessed folks get accused of things in people's homes because they were in there when they were not, when the participant was not. And we never want someone to get in a situation where you're liable for something that and not necessarily able to prove one way or the other. So really just not being in someone's unit without them inviting you in and then being there present. And I know that might seem really, really like elementary, but it can be the Wild West out there sometimes. And so I just want to make sure people understand how important that is. And of course, we have lots of participants like, can you take my keys while I'm out of town and water my therapy plants or check my mail or all those things? And unfortunately, we should never be doing that, but we should be helping them navigate who might be able to do that for them. All right, this is the last principle. It's not the last part of our training, but it's the last principle. And this is the flexible and voluntary services. So really, are we allowing someone to choose the services they receive? Are they the ones that are the author of their service plans or their treatment plans or housing plans, stability plans, whatever you all call them, because they're different across the board? Are they the ones that get to decide what goals they want to work on, and you help them write the plan, but they're the ones that are making the choices? And sometimes there is a participant that doesn't know exactly where to start, and that's where we come in. But we would never want to tell someone this is what I think you should be working on, and they should always be able to change their mind and modify that in real time. So they change their mind, that plan should be changed in real time, so that the next person that might have to come serve behind you knows exactly accurately what's going on with that participant. So we should be having very, very in real time, live and breathing treatment plan documents that get changed and also reviewed on a regular basis. We shouldn't be going into appointments very often without reviewing what we said we were going to be working with on with that participant, and maybe looking at the last note that you wrote so you can recall, because we're all serving lots of folks, that you know exactly what you said you were going to do at that next appointment. This is voluntary, meaning a participant cannot be required to. It's not a compliance thing. They volunteer to be part of FCS. They volunteer to be part of HARPS. This is voluntary. We should not be telling them they have to do something or comply in order to receive services. They can have no services. We could get them housed, and then they say, "Peace out, Kimberly. I'm done. I don't need your service anymore." And I say, "Okay, I'm here when you do." Right? They don't have to be part of the program if they choose not to. They get to choose, like I said, location, duration, frequency, how available they are, where they want to meet. That really should be up to them. FCS in particular is considered a community-based service, meaning that most of the services you provide should be outside of the office and in the community, meeting the people where they're at, navigating the supports they need in the community. Yes, if people choose to come into the office, that's great, but FCS was never designed to be you sitting behind a desk waiting for people to come to you. We really should be out there looking for housing, working with landlords, navigating resources, and walking alongside our individuals. So there should never be agencies that are saying that we don't go out in the community. We only do this in telehealth. So that is not what this program is designed to be. So we want to see you out there. People can change what kind of services they have. They can change the intensity of it. They should all be person-centered. We should be having lots of, participant voice in our documentation. We should also be having participant voice in the treatment planning. We should have participant voice in the feedback. So do you have a formal feedback loop that allows the participant to come to you and tell you how great you are, or how much they hate the program, or how they think you should be doing this differently, or that they want more money to the program, or whatever the case may be? We need more housing. We should have a formal feedback loop in place that they know how you're going to use it, and you look at it and you have some sort of plan for a participant can give us anonymous feedback. The leadership's going to look at it quarterly. We'll meet about it, talk about what things we can implement, which things aren't doable at this time, and then make sure the participants know the policy around how we use formal feedback. So those are things that should really be in place to make sure you're capturing person-centered services. Some places go as far as having Sarah, I don't know if you remember this, but Recovery Innovations used to have a city council where participants could be part of a city council, and they had badges and they got to make decisions, and things would come about it. Like they decided they wanted like kind of a Zen station that people could go and just chill and relax with headphones and things like that. There was other things that they implemented around different classes they'd like to see for being offered. And so that gave some power into what kind of provisions existed in the program. And that's really powerful for those participants that feel like they don't have any say in what happens. And so it could be something like that. It could be surveys you do. It could be a comment card space in the office. It can look like a lot of different ways, but there should be a policy and a feedback loop around that. Yeah, I hate participant agreements. I'll just say that. I'm going to be completely transparent. Brianna, I don't like when I go in and see someone make the folks sign a participant agreement saying they're going to engage this often, they're going to do this, this is the expectation, because again, then the participant automatically assumes that their services or their housing's held over their head if they don't do those things. And the majority of the time, what I've found is it definitely is taken away from person-centered programming, but also a lot of people will tell me, well, we don't really enforce it. And I'm like, well, if you don't really enforce it, why are we having them sign it then? Are we, maybe it's about telling them what they should expect from you, and not you telling them what they need to be doing for you. So you really should be giving them sign something that says, this is what you can expect from FCS or HARP services. These are the things that we'll do. And also, not that you have to engage, but more frequent engagement is going to give you better outcomes, right? You're going to find housing more quickly, likely. So engagement does improve your outcomes. And maybe have language more that way than saying, if you don't, you must, compliance, blah, blah, blah. I hate all those words. This is voluntary. We should never be telling someone what they have to do. Okay. So I could go on a whole tangent about that. Thank you for Brianna for bringing that up. I do not like participant agreements or service agreements. I think that if you want to have someone sign something, it should be that they are signing something saying, I agree that this is what I can expect from you as an agency and a provider. Caseload sizes. We really want caseloads to be small. The idea behind the types of services and the population we serve is that this is intensive case management. I'm going to speak specifically for FCS in this moment, but FCS was designed to be intensive case management for high need individuals who may need more case management support than the average Medicaid beneficiary or the average, even just, people out there, right? And so in order to serve someone well, meaning you're seeing them when they need to be seen, you're being able to do all the documentation you need to, and all of the coordination of care, which is key. We're doing wraparound services. It takes a village. In order to do all that for your caseload, you need additional time to be able to do that. And if you're serving 26 plus people, tell me how you're serving someone who might need to see you 2 days a week, 3 hours a day, plus all your other folks who also might want to see you multiple times a day or multiple times a week. Maybe someone's asking for a ride. Maybe you're trying to see your regular folks that want to be seen weekly. If you're trying to navigate that and you have huge caseloads, you're going to be burnt out. You're not going to be able to do it well. And that affects them and the services they receive. So lower caseloads ensure that we're getting better outcomes, that we're serving people well, and that we can wrap around them by doing all the things that are outside of just face-to-face interaction, right? That documentation is serving someone, coordinating care is serving somebody. So we want to make sure that we have time to do that and do it well. All right. All services are provided by a team. So I want to remind you all, this evidence-based practice was originally designed by SAMHSA for behavioral health organizations providing these types of services. However, if you're not a behavioral health organization, the idea behind this is, are you coordinating care with behavioral health, substance use, primary care providers, right? Are we making sure that we're working with all the other folks that are serving our individuals? So when you're intaking, are you asking them, are you seeing a behavioral health provider? Do you work with, a SUD provider? Do you have primary care? Would you mind me having you sign a release? So in case I need to, I can coordinate care and make sure that you're not having to do that work on your own. These are really important. We want to make sure that we're engaging in behavioral health. As a housing specialist, I have learned the very hard way that if I am not coordinating with behavioral health, I'm in a bad position. And I have an example of when, you guys might be the first people going into someone's home and seeing that they're not doing well. They might come into the office and present great, right? But you're doing a home visit, and today you've gone in and you're tunneling through boxes in their house, and you notice that there's dishes laundry in their dishwasher. And this is an example, a real life example. And they have boxes in their shower suddenly. That doesn't look like their baseline, right? If I hadn't gone to their house, I wouldn't have seen that. And then when you start talking to them, they mentioned something about maybe not taking their meds. So if I didn't have coordination abilities with my releases of information, I could never contact their clinician or even crisis to make sure that they are on the radar for maybe needing some support, getting an appointment made for them. And in this example, I had thought I'd done my due diligence by coordinating care and then went about my way. And then I went back to check in on this participant and found out they had gotten detained 2 days later, but no one informed me, right? And then in the meantime, they got an eviction notice. So, if we're not doing our due diligence to make sure we're coordinating care, we could be putting participants at risk. And so really thinking about, some people do not want us coordinating. They don't want us sharing information on their behalf, and that's fine. They get to choose that. I actually used to have a participant that would edit my ROIs so that they wouldn't count anymore, but it made her feel better to do that. And so I'd allow her to, but then just be like, I can't use that to coordinate. And she'd be like, that's okay. I didn't really want you to anyway. So, but we really want to encourage that so that they don't feel like they're having to share their story. They want to know, why don't you know that if you're talking to them already, right? So making our due diligence to have regular meetings with behavioral health, substance use provider, is there a primary care that we can get a hold of? Part of the thing about primary care is a lot of our folks wait till it's emergent and use the ED instead of going and engaging in healthcare. And because of trauma and things like that, it's really hard for them. And so if we can help them re-engage in healthcare, help them navigate appointments and things like that, they're less likely to use EDs for reasons that aren't necessarily emergent. And so those are things that can help us ensure folks are staying healthier. And then the last one, our services available 24/7. I would like to see a show of hands if any of you guys are providing services 24/7. Very few actually do. We do have some folks that have like on like phones that can be on call type situations where landlords or participants can get a hold of the housing folks if they absolutely need to. We had that when I was doing housing, and we got very few calls over like 7 years. Some people have crisis lines that can get connected to the housing specialist if they need to. So it's not expected that you're 24/7, but if you're not 24/7, are you able to flex your time in case someone needs to be seen after 5 because they got a job now, or when they need to be seen in an apartment on a Saturday because that's the only time the landlord's available? Can we flex? Are you able to do that? Do you have conversations with your supervisors, or is there a policy around that? And also, if there isn't even that, are we providing after hours resources, hot meals, drop-in centers, places where they can, respite, right? So there's different ways to do it. We just don't want you as housing specialist taking your work phone home and answering at 8, because you also need to refresh and be there and be rested to serve people the next day. So depending on what your schedule is, like you, Michelle, said, you work on a weekend, some folks don't, some are just strictly 8 to 5ers. So it just kind of depends. Maybe you're working more of a, 10 to 7. People that have those kind of overlapping shifts where there's people that come in at 8, and then there's a group of people that come a little bit later at 10 and stay longer. That allows a little bit more flexibility to serve folks. So there's different ways to do that to meet fidelity and get closer to it without having to be 100% 24/7. All right, I'm checking time. We have 10 minutes. Trying to think of what's next. Okay. I'll keep going for about another 5 minutes, and then I want to leave a little bit of time, just like 5 minutes for questions. But what to expect at a DBHR review is we most of the time do them in person for FCS. I know HARPS, I think you guys do a lot of yours more virtual. We did do virtual reviews during the pandemic to ensure we could still do that, and they work fine. I personally prefer an in-person just because you kind of are there. You can see where the staff is sitting. You can see how they're marketing the program. There's a little bit less challenges around documentation, especially if folks are having to scan things to you. Not everyone has EHRs that they can give you access to. So anytime you're having to scan documentation, it's hard to know if you're giving them enough, or if you're getting them what they need. So typically a in-person would be 2 days. I have been able to manage to do a 2-day in-person review really about in a day and a half. Typically, we usually get out the second day between 1 and 2. Virtual does take a little bit longer. We try to spread it out across a little bit more time to ensure that people still have time to do their own work. And also being on screen for 2 days straight is, I don't know about you, but I'm on screen a lot already. And so being on a computer, just sitting for 2 days straight is a little tough, especially for those of us who go out and work in community and are used to being kind of moving and shaking. We do schedule some pre-prep stuff. You'll get a prep letter if you're going to be getting a review. And we schedule meetings with the team to see what they need to prepare, answer any questions for them, get them ready to start, planning for the fidelity review. I typically do a meeting with my review team to make sure that they don't have any questions, know where they're going, know what they're prepared for, because I do sometimes get a lot of review teams that are fairly new to the work. And so just trying to make sure we do that. Part of it is scheduling an agenda. So all housing case managers would get an interview. We include leadership, and when we can, we try to do executive leadership to really hear about the implementation of supportive housing. And then we try to interview participants who are receiving services. I always ask for 2 or 3. A lot of times we may only end up with 1 on the day because somebody's changed their mind or something comes up, but we really do. That participant interview is probably one of my favorite parts of the fidelity review, is really just getting to hear from the participants about how they're being served, and just connecting with those folks. I like to ask questions like, if I had a magic wand and you could live anywhere, what would that look like, right? And I love hearing the things that they'll tell me about. I want to be completely off grid. I want to live on a farm. And it's just really cool to allow them to have some hope and allow them to continue dreaming for that end goal, which is what they want, is wherever that dream home is, right? I think we all have that. So a typical review, and I might have a duplicate slide here, for not positive, but a typical review is we start off with orientation, introductions. Then I have the agency give us an orientation to their agency and maybe how other programs intersect with my program that we're reviewing. Then we talk about what the 2 days are going to look like. I have them give us a tour if it's worthy of a tour. I have one agency that's like, this is our hallway. That's your tour. So it really depends on the agency, what that might look like. And then there's others that have, multiple buildings and things like that. So getting to see where the staff are working, how they engage with other parts of the agency or programs. And then we just really dive into the fidelity review, which is doing the interviews, doing the documentation review, looking through policy and procedure, looking through marketing materials, looking through job descriptions, meeting notes, and then we do 10 files, 10 participant files. Hopefully 2 of them are the 2 that we're interviewing also as participants. Once we do all that doc review, we typically bring everyone back together. I call it the final Q&A, where we bring everyone back together. We ask any additional questions we have based on what we've seen. Maybe it's a clarifying question. Maybe I don't understand. You said you did this, but I haven't seen any proof of that kind of thing. Or maybe it's just like, can you help us better understand this process? And then the agency has the opportunity to come back to you as a reviewer and say, hey, we just wanted to make sure before you score that you know this, or we forgot to tell you this, or I just wanted to make sure you understood this. And so it gives us some time to just clear it up before we go into consensus scoring, which would be the next thing we would do. I typically take my review team offsite, go somewhere, have some coffee or food, and we do scoring. And then the agency will either get their score that day, depending on the agency and how anxious they are, or typically we will let them know once they have their report written. And we'll talk more about report writing later on. Any questions so far? Doesn't this sound like so much fun? If you're an auditor like me, and I don't like to use the word auditor because this isn't auditing, but it has that sense of like being able to like really just fine tooth comb and see what's really happening in the space. And like, I love that that kind of piece of being able to look at a program, see what's happening. Part of my favorite part of the fidelity reviews is that they're peer-to-peer. That's a model we've always done in Washington, whether it's FCS or HARPS. We bring people from other agencies in to be part of the review team. That is gold. That is where the most value is for providers a lot of times, is having that networking, seeing how other providers are doing the same services, learn from one another, shared resources, shared documents. I love that about a fidelity review. I think it's golden. And when you can get your provider network that connected to each other and work together, it makes communities work better together. It's just the best. Wanda, I see your hand up.
What's the highest score you've ever seen?
Oh, the highest score I've ever given is a 26.25 out of 28, which is extremely high. And if that provider were to tell me today, the provider would tell me today that they wouldn't still get that same score. And part of this is, and we'll talk about this tomorrow, the score can vary depending on the population you're serving. It's like point in time, the population you're serving right now, the documentation you're doing with those people, the types of housing that is available in the current market, the review team you have on, right? Because you're doing a consensus. So each person comes from different perspective. Maybe Wanda was in an interview with the case manager with 2 other people and I didn't hear. That's why we do consensus, because some people might be in different spaces hearing different things. So 26 is really high. And also it can be achieved. It just depends on what type of agency you are, who you're serving, what your housing looks like, what your policies look like. And all agencies can get closer to fidelity. Whether everyone can meet it perfectly, maybe not, but we know that we can get you closer to it. And that's really the goal. No one's going to get a perfect score. Never seen it, never will. Because people have choice, you'll never see a perfect score. And that's the main thing, is we're honoring choice here. So you can't control the choices people make around their housing types or all the things. So great question, Wanda. We have a lot of people that focus solely on the score. And I always say, don't even worry about the score. We all want to be A+ students, we do. So that number just somehow just gives us satisfaction when we get a good one. But really the focus and the point of Fidelity is to look at the report and the recommendations you receive from the review. Those are what's really the gold for you, is that you know you've got some great recommendations. That report's not only going to highlight recommendations, but it's also going to highlight all the great work that's happening, the strengths of the agency, the strengths of the team. So this isn't just about what I can learn from it, but it's also about, wow, I get a pat on the back for doing this right, or doing something good, or taking care of my participants well, or they like the creativity in this process we developed. It's really, really interesting, and also fascinating to see how different agencies do things. And it's pretty fun. I think Fidelity's fun, and I might be nerdy like that, but I'm okay with that. I can't wait, Crystal, for you to get to do a review as well. That's great. Sounds like there's some one scheduled soon. Any other questions, thoughts before we close out for today? We hit 3 o'clock, and I want to make sure I'm honoring people's time. Okay, think about it, absorb it. We'll be back together tomorrow at 1 and finish this off. And again, after tomorrow, I'll make sure everyone gets the slides. Think about those questions, write them down, and we can start tomorrow with a few questions before we just jump right in. Thank you for all joining me today, and having to listen to just one single head most of the time. Typically we do this with 2 trainers, but FCS is currently only having 2 trainers on anymore. So you're stuck with me for now. Same link. That's a great question. I did notice that not everyone registered for the second day. I'll put that in the chat here as soon as I can. Let me do that right now. And I hope you all have a great afternoon. Trying to copy it, but it won't let me copy.
Be safe, Kimberly. Talk to you tomorrow.
All right, thank you, you too. Take care, everyone.
Bye-bye.
Hey, Kim, I have a question for you.
Okay, go ahead.
This is off topic. I just wanted to ask if you have any, let's see here, the chronic homeless attestation document that you can forward link social services so we could use.
Yeah, I can send it to you, or I can get it to you, but you can get it on the WellPoint website as well.
WellPoint website. Let
Yeah.
me see. WellPoint. Let me just go on there real quick. Thank you so much.
Yeah, there's an attestation on there. Yep.
Mm-hmm.
All right. Thank you. Have a fantastic afternoon, and we'll see you tomorrow.